Hey, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today we're going to be talking about high blood pressure, causes and solutions. So let's get into it. High blood pressure is also known as hypertension. Maybe your doctor has said that. It's typically more diagnostic and put on insurance paperwork. And it's defined as a systolic first number of your blood pressure higher than 120 and the diastolic, the second number, higher than 80. And what that is, that's the pressure inside your blood vessel walls, pushing against your blood vessel walls. Some interesting statistics here. 50% of all Americans have high blood pressure. That's kind of scary. Which can cause heart disease and stroke, right? That's a big problem. In 2020, check this out. In 2020, 670,000 people died of primary high blood pressure. So with high blood pressure, your heart has to work overtime to move blood around your body to get to your organs and your tissues. And the heart can only do this for so long. And then after a while, it finally can't do it and you end up having heart failure. Not a good thing. So let's talk about here is what you need to know about this. I would suggest you take notes because this number one especially, I want you to write this down. I want you to circle this. Highlight it is a great thing, great statement. Ready? Number one is insulin resistance and high blood pressure are related. Insulin resistance and high blood pressure are related. Number two, almost all people with high blood pressure are insulin resistant. That's prediabetes for those of you that don't know. Insulin resistance and high insulin can cause high blood pressure. That's kind of a problem. Now, number four, aldosterone. Let's talk about a hormone that's secreted by your adrenal glands. Adrenal glands sit on top of your kidneys. This is a hormone that has to do with water balance in your body. And so when your aldosterone goes high, what happens, your body starts to retain sodium, salt. And what happens is water will follow that salt and you'll retain fluid. Your blood volume goes up and your blood pressure goes up. Well, guess what raises aldosterone? Insulin. So let's talk about number five. What about thicker blood vessels? Really interesting thing here. So insulin is an anabolic hormone, meaning it's a growth hormone. And imagine insulin flowing through your blood vessels, and you have an inner skin lining in all your blood vessels called endothelium. So imagine the skin inside your blood vessels, and the cells of that are stimulated growth-wise by insulin. So the problem there is that if you have maybe a normal supply of insulin there, it goes up and goes down. Okay, not so bad. But perpetually high, chronically high insulin is going to stimulate the growth of the cells and literally narrow your blood vessels, raising your blood pressure. If you ever put those little tiny nozzles on the end of a water hose, all of a sudden that stream comes out harder and faster, right? Higher pressure. So when you narrow the diameter, it's going to increase pressure. So that's another reason and cause behind high blood pressure, thicker blood vessels. How about number six? Blood vessels cannot dilate. And this has to do with something that's called nitric oxide. Interesting. So that inner skin lining, the endothelium, is what produces nitric oxide. People that had a heart attack, they're given nitroglycerin, a form of nitric oxide that tends to relax and dilate blood vessels so you can improve blood flow and all of a sudden you can stop angina or chest pain. So nitric oxide is produced by the endothelium. And guess what? Normal levels of insulin can stimulate the release of nitric oxide from your endothelium. However, chronically high insulin actually impairs the process and causes a problem so that you end up with what? Tightened down blood vessels because you end up not having enough nitric oxide. So excessive insulin or higher levels of insulin That insulin resistance makes your endothelial cells less responsive to producing nitric oxide. Not a good thing. Number 7, narrowing of blood vessels. Now, I like to talk about the autonomic nervous system, and there's that fight or flight side called the sympathetic nervous system. When that is more in control, because who doesn't have stress, what happens is your blood vessels tend to tighten down, and like I'm telling you about that narrow nozzle on a hose increases pressure. What happens when that side of your nervous system is more in control, your blood vessels will narrow down, tighten down, and blood pressure goes up. Well, the problem there is insulin resistance keeps your sympathetic nervous system perpetually high, hence your blood pressure stays higher. Not good. Number 8, unhealthy changes in your blood fats. Now this I could spend I think I have done an entire podcast just on this one topic alone. Blood fats. You go to your doctor and they do blood work and they measure your lipids, which is total cholesterol, HDL cholesterol, LDL cholesterol, triglycerides, those sorts of things. And as you know, HDL cholesterol is supposed to be the good cholesterol because it's cardioprotective, protects your heart and blood vessels. Whereas LDL, is supposed to be the bad guy, is the problem that's connected somehow to causing heart disease. Well, the interesting thing is when you look at this, if your doctor, and I really recommend that you encourage your doctor, yell at your doctor, because remember, this is your health in your life, to do not only a lipid panel, but to measure pattern A and pattern B. Measure the LDL cholesterol patterns in your blood. So what that looks like is you have pattern A and pattern B. And if you can remember this, pattern B is the bad guys. Pattern A is the big fluffy, I always visualize in my head, big fluffy, looks like popcorn. They're really light and they do not stick to your blood vessel walls, does not cause any problems whatsoever. It's the pattern B. Imagine a small, tiny pebble that's super heavy and super dense, and that can wedge into those endothelial cells and between them and start to cause problems in there. Here's the rub here. Here's the problem. Guess what raises pattern B cholesterol? Guess what makes your liver create more pattern B cholesterol, the bad guys? High insulin does that. Again, you want your insulin to be normal or low. So do you get this? Here's the problem. Insulin resistance promotes LDL pattern B, not good. Insulin resistance promotes another thing that's called oxidation. It damages the fats in your blood. That promotes inflammation and causes damage to your heart and blood vessels because it creates plaque. So high insulin oxidizes your blood fats. High insulin promotes inflammation. All of this creates plaque within your arteries. Not a good thing. Hence the reason that you might want to consider changing your diet to really, really good fats like animal fats and avoiding seed oils and vegetable oils. Really should do that. So what's the takeaway? Here's the bottom line. These are the things you really, really need to understand. 1 in 3 people have insulin resistance. That's a lot. 1 out of 3 have pre-diabetes. And guess what? Pre-diabetes damages your heart and blood vessels just like diabetes does. The problem with blood sugar problems is not, oh, I've got diabetes, I've got a disease now. No, it's doing damage and destroying your heart and blood vessels because heart disease is still the #1 killer. Number 2, what causes insulin resistance? Okay, here's the thing you're not going to like. Eating starch, sugar, and drinking alcohol. Starch, sugar, alcohol. Now, I might say this, and I work with a lot of patients with these types of problems, and here's the problem. It really, really hurts my heart, so to speak, is that I can suggest, I can encourage, I can show and demonstrate to them, but when it comes right down to it, will a person truly change their diet? Will a person truly take out the starch, sugar, and alcohol out of their diet? That's the big deal, because it really will make the difference. It really does. This is the essence of most chronic disease. High insulin. What causes insulin to go up? Starch, sugar, and alcohol. Big, big deal. All of my testing over the last 35 years always demonstrates that blood sugar issues, even prediabetes, insulin resistance, causes high blood pressure and damage to heart and blood vessels. And that's the bottom line. That's the bottom line. So those 5 important takeaways, please replay this, hear this again, even if you just listen to those last 5 items. Really, really essential. What else? No, so what can you do about this? My suggestion is immediately start on a ketogenic diet or a carnivore diet. Ketogenic, the subdivision of ketogenic is carnivore. And what it is high fat. Ketogenic is a high fat diet, which is great for your brain, great reparative to your blood vessels. It's great for your hormones. There is no downside if you're putting in great essential fats into your body. Carnivore is even better because it's animal proteins, animal fats, electrolytes, and some fish oil. Really, really good. Takes all the inflammation out of your body. It's absolutely amazing. It can shut down autoimmune disease. Doing the carnivore diet, phenomenal. This is exactly what I'm doing. So my breakfast this morning was bacon and eggs. My lunch was bacon and eggs as well. Tonight's probably going to be a steak. Steak's what I had last night. You can do chicken, you can do lamb, you can do fish, you can do bison. A lot of things. And it's amazing that that essential I'm hungry completely goes away, and then you can choose to fuel your body with really good foods as opposed to I'm hungry, that sounds super good, I'm starving, craving this food. That completely goes away. And guess what? Your body composition naturally normally tightens in and you feel and function optimally. It's really, really great. A couple of other items that you could choose to do if you like to do this is a couple of items, a couple of nutrients that you could take to improve your blood sugar and really help to pull you out of that deep hole of insulin resistance, prediabetes, or even diabetes. It helps with a product called Metabol Complex from a company called Mediherb. Metabol Complex. Let me tell you what's in Metabol Complex. Fenugreek seed, black cumin, bitter melon, as well as cinnamon stem bark. That product amazingly helps people with blood sugar issues. Really does support a person. Does it conflict with medication? No, it doesn't. What you'll notice is your blood sugar begins to normalize, and hence you'll have less need for insulin. But critical is the dietary change, because if the fire is prediabetes or diabetes, and you keep adding fuel to the fire really never goes out. So you have to change your diet. Another product is called Gymnema. Gymnema is a phenomenal herb that works at that level of helping your pancreas with insulin. Helps it produce insulin, helps the beta cells that make insulin work better. And it also takes away cravings. Beautiful herb, again, no conflicts with medications, phenomenal. If you'd like to know more about this, let me know. Love to help you out there. If you need any help with your health challenges, I'd love to help you out. Please contact me at draugustine@gmail.com, draugustine@gmail, or you can contact my office at 562-860-3404. If you like the content in this video, I'm on podcasts, I'm on all the social medias, Instagram, TikTok, YouTube. As far as podcasting, we're on Apple Podcasts, we're on Google Podcasts, as well as Spotify. Please like and subscribe there too. I'd love to help you guys out. And again, my name is Dr. Augustine from Head to Wellness. I hope this helps you. Have a great day.